Okay, well, it is noon, and in the essence of being respectful for everyone's time this afternoon, we can go ahead and get started. So we are going to walk you through Samantha and Ted from the Bergman team, and I should take a step back and introduce myself. I'm Kimberly Baptiste with Bergman. Bergman has been working with the town and the committee in developing the Middle Cheshire Road Healthcare Corridor Active Transportation Plan. And this presentation is focused on sharing the final recommendations with the community for consideration. So I think, Sarah, you were going to maybe kick us off a little bit, and then if you want to hand it over to Sam, she will be starting the presentation.
Sure. Thanks, guys. This is Sarah Reynolds with the town of Canandaigua. Before we go too far, just a couple of housekeeping items for everybody on the call. First, thank you for joining us. And second, if you are not speaking or presenting, if you could please mute yourself to make it so everybody is able to hear clearly. Thank you. And I just wanted to say this has been a really interesting and fun project to work on. I want to say thank you to our steering committee members, some of whom are on the call today. We also have some people who are involved in other town committees and boards joining us today. So for those of you who haven't been following along with this project, it's been going on for about a year now. The town was awarded with a grant from the Genesee Transportation Council to work on the corridor area to look at methods to improve transportation for all users of the corridor. So I won't take up too much time, but thank you to everybody involved. And we do have a chat. If you have questions, we can probably have a few times throughout to answer those questions. So feel free to do it that way. And I'll turn it back to the Bergman team.
Okay, great. Thank you, Sarah. As Sarah had mentioned, if everyone could just make sure that they have their mute button on during the presentation, we'll definitely have approximately 15 minutes at the end of the presentation to take any questions and comments, either verbally or through the chat box.
I don't know if I know you're probably still on your walk home, but okay, the meeting is just now starting with.
Yes, if you could please put your microphone on mute. Thank you. Okay. All right, so just a brief overview of what we'll be covering today. We'll be going over the purpose of the Middle Cheshire Road and Health Services Corridor Active Transportation Plan, as well as the community engagement we conducted of this process. From there, my colleague Ted Liddell will be discussing what our team found as the key corridor opportunities and our recommendations as it relates to transportation and placemaking to really enhance mobility and increase the area's sense of place. So just beginning with the plan overview, what is an active transportation plan? Well, really it's a set of recommendations to ensure safe modes of transportation for all, but with a particular emphasis on pedestrian and bicycle mobility. So the purpose of an active transportation plan is a way to identify methods to ensure the transportation network operates efficiently, but provides a level of comfortability for those both on bicycles and on foot. So for example, throughout this process, we ask questions like, are there opportunities to restripe the roadway to incorporate dedicated bicycle lanes on the roadway? Or are there spaces where we can do some off-road shared use paths? Or are there opportunities for enhancing pedestrian and bicycle amenities such as signage, benches, and enhanced landscaping along the roadway as well? The study area for this effort really expands Middle Cheshire Road and West Street from approximately Wells Curtis Road, where it connects to Westlake Road or County Road 16, to Bristol Street within the city of Canandaigua. Our team understood that there were a variety of recreational and institutional destinations in proximity to the corridor. So essentially the impetus of this plan was to identify ways to enhance connections to those destinations in a safe manner. One of the things along the corridor that we took a particular look at was the intersection of routes 5 and 20, since that was identified as a barrier for pedestrians and bicyclists coming from the residential section of Middle Cheshire Road entering into the city near the Thompson Hospital. There are a number of objectives that we set out to achieve through the study, many of which relate to the preferences of pedestrian and bicycle treatments that residents and users would like to see along Middle Cheshire Road. So we understood that the majority of Middle Cheshire Road is comprised of residential and agricultural land uses. So it was important for us to talk to residents about the types of multimodal transportation options that they felt comfortable using along the corridor. It was also important for us to examine and identify improvements at key intersections, such as the routes 5 and 20 intersection, which currently, as I mentioned, acts as a barrier at the town-city line. What are some ways that we can increase pedestrian and bicycle access at that location? And in addition to some of the pedestrian and bicycle treatments on the roadway, we also wanted to explore placemaking and amenities throughout the corridor. So what are some ways that we can enhance the sense of place and make it more comfortable and enjoyable for users? Is there an opportunity to enhance wayfinding signage to direct certain people to different areas along the corridor, such as the switchback trail that connects to the city of Canandaigua Lakefront? Or are there opportunities for benches and seating along the corridor? And lastly, the purpose of this plan is really to identify a framework for the town and city, working with the county and transportation moving forward to implement the recommended options. The project really had 5 main components that allowed us to achieve these goals and objectives, and community engagement being the first task was something that really extended throughout the entire process. We implemented a myriad of methods, including steering committee meetings, public workshops, stakeholder meetings, as well as online surveys. And I'll talk about those methods in a couple of minutes. But just know that's something that we thought was really important to the overall process. We also conducted an existing conditions assessment to look at physical characteristics of the corridor, which really led us to derive key opportunities and constraints through a needs assessment. And based on these opportunities and constraints, we did recommend a set of treatment alternatives that we'll talk about and later on in this presentation. All of this is really encompassed in a document with an implementation framework that's intended to be used as a guide and community resource for the town and the city to implement these enhancements as resources become available. So as I mentioned, community engagement was an important part of the process. And due to the COVID-19 pandemic, we did have to adjust some of the methods of obtaining input. However, we were successful in reaching a variety of residents and stakeholders in the community, which led to great feedback and this community-based plan that we are presenting to you today. In August, we were able to hold an outdoor workshop where we created informational and educational boards for attendees to participate. And these boards really explain the types of potential treatment options that could be implemented along the corridor and asked participants their thoughts on preferences of these potential options. There were approximately 12 attendees that were able to provide their input. So to really supplement the feedback that we got at the workshop, we also conducted an online public survey that mirrored the questions within the workshop. We had great success with this, with over 60 respondents, and we were able to use this feedback specifically to develop key alternatives for the corridor. So on the screen here, you'll just see some of the questions and variety of questions that we were able to ask respondents. And on the left-hand side of the screen, we asked types of treatments that residents would feel most comfortable using on different segments along the corridor. Whereas on the right-hand side of the screen, we asked participants to rank their priorities in terms of pedestrian amenities or specific improvements that they wanted to see implemented. And what did this engagement tell us? So on the screen here, you'll see a few key themes from the engagement. The first one being that traffic speed was a concern along the corridor. And in order to address this in the plan, we have included a variety of pedestrian and bicycle treatments along the corridor, including crosswalk enhancements and signage, things like that, to alert drivers that there may be multimodal users on the corridor, and in turn will have them slow down. Off-road shared use paths were also a preferred treatment option for residents along the corridor. So we wanted to be sure to include this as some of the treatment recommendations as well. Crosswalk striping and intersection enhancements were a desired improvement for this area. So we have recommendations related to how to increase visibility of crosswalks while enhancing visual character. And Ted will talk a little bit more about this when we get into the specifics of the recommendations. And then just talking about amenities. Amenities such as bike racks and benches, trash receptacles were not as high of a priority to respondents. However, we do have a number of placemaking amenities recommended in areas where we would likely see higher pedestrian usage, such as the Thompson Hospital area or the switchback trail entrance that leads into the city of Canandaigua and the Canandaigua lakefront. And from there, I will pass it on to Ted to talk about some of the identified opportunities that we saw along the corridor.
All right, thanks, Sam. Good afternoon, everyone. My name is Ted Liddell, and I am a landscape architect with Bergman. And I'm going to be walking through with you today some of the recommendations that the project team has come up with throughout this process. What you're looking at on the screen right now is one of a portion of our needs assessment where we were looking at opportunities and constraints throughout the corridor, based on our existing conditions analysis and feedback that we received from the community during the public engagement activities and the survey. We started to look at what those opportunities and constraints were throughout the corridor, and how those could potentially influence recommendations that we would want to make in terms of ped bike amenities and multimodal transportation. So just looking quickly at this graphic, what it highlights is that the intersections up near Thompson Hospital, Parish Street 5 and 20, that those were intersections that we needed to take a look at to be able to provide some of that ped bike connection, where some of it doesn't exist today. Routes 5 and 20, as Sam mentioned, is definitely a barrier between the northern and southern portions of the corridor. In our analysis and existing conditions survey, we noted that there were segments of the corridor that did not have any ped bike amenities. So were there opportunities to complete the system and create a continuous ped bike facility throughout the corridor? And are there opportunities to connect that to existing residential neighborhoods that are adjacent to the corridor or other amenities like the switchback trail? This graphic just shows the southern portion of the corridor, which is a little bit different in feel and use. There's a lot of agricultural uses down in here in this segment. But at the southern end, we connect to Wells Curtis Road and then eventually West Lake Road. This was a connection that was identified early on, that it was important to make sure that Middle Cheshire Road was connected to West Lake. It was identified in previous studies and throughout our engagement that providing connection for bicycle users to this corridor was really important to consider from Westlake Road. So what I'm going to do is first walk through with you the bicycle and pedestrian facility improvements that we are recommending. A majority of these improvements will fall on the east side of Middle Cheshire Road, with a small portion being on the west side at the southern end. But it will be a variety of trail types. We're looking at side paths and multi-use paths that will work together to create a cohesive pedestrian bicycle connection throughout the entire corridor. We're going to start at the southern end at Wells Curtis Road, which again I had mentioned was brought to our attention as it was very important to make this connection for bicycle users from Westlake Road to Middle Cheshire through by Wells Curtis Road. And what we're proposing here is that the road be restriped and the shoulder widened to include 5 foot, to have 5 foot shoulders that would be used for bicycle users to be able to make that connection. Press the wrong button here. Once users got up to Middle Cheshire Road, the facility would then be on the west side of Middle Cheshire. What we're proposing is an 8 foot side path with a 2 foot buffer, and that 2 foot buffer would contain a rumble strip to help signalize to drivers and prevent encroachment of drivers onto that multimodal ped bike facility. In this area, one of the things that we had to consider was the existing farm practices that are occurring in this segment of the corridor. We wanted to make sure that any improvements that we were recommending didn't impede on any of the transfer of farm equipment or materials, anything that would prevent or inhibit the farm practices from continuing to function as they do today. Now that treatment would continue all the way up to Foster Road. This graphic is a little hard to see, but on the west-hand side here is that 8 foot shared use facility, which would then cross at the northern end of Foster Road to the east side of Middle Cheshire. This would include, highly visible crosswalk markings with ADA accessible, detectable warning strips, and also, adequate advisory signage to let people know that this crosswalk will be occurring. Now, north of Foster Road, we will continue on the east side with an 8 to 10 foot side path. In this segment from Foster Road to White Cliff Drive, we're looking at an 8 to 10 foot path separated from the road with a 3 to 4 foot buffer that would contain a vertical separation. So there would be a fence or a guide rail. It could be a variety of different materials that are ultimately implemented, but it would act as a vertical buffer to help delineate between the vehicular traffic and the ped bike facility. As you continue north from White Cliff Drive to West Ridge Run, we would still continue with that 8 to 10 foot side path. What you can see in this graphic is, if you can see my cursor here, we say 8 to 10 foot range for the path because there are a number of existing utility poles or other elements in the right-of-way that might not be easily able to be moved, that we might have to work around. So we've identified a number of those scenarios throughout the corridor and are recommending that this path range from 8 to 10 feet, with 8 feet really being our minimum width that we would want for a multi-use trail facility. And in this segment, the trail would be separated from the road by the shoulder and also the existing 3-foot concrete gutter that exists today. As we move further north from Westridge Run to routes 5 and 20, the facility would then transition to a 10-foot shared use path separated again by a 3-foot buffer with the rumble strips to help provide that separation and signalize to vehicular users that they would be encroaching on the ped bike facility if they would happen to go over the rumble strips. North of 5 and 20 to Bristol Street up by Thompson Hospital, there's a little more room that we can deal with here. So we're looking at an 8-foot shared use path facility on the east side with a pretty good buffer of about 10 feet. This allows us to implement more of those kind of placemaking elements that Sam had mentioned, with bike racks, benches, some facilities like exercise stations and things like that were desired in this area as well, along with some enhanced landscaping. So it provides a little bit more opportunity to include those elements up by the hospital. So those were the kind of the what the facilities would look like in between the major intersections on the corridor. But there were a few intersections that we looked at and we are recommending improvements to help increase safety between vehicles and pedestrians, and to just overall create a safer, more multimodal functioning corridor. So we'll start at the south again, and we'll look at just quickly at the Wells Curtis Road, Westlake Road intersection. If you go out there today, the intersection is very, very wide, and it's not well defined with striping for the travel lanes, and it's definitely not well striped for bicycle users. What we're recommending here, and this is a recommendation that also has been carried through a couple previous studies as well, is looking at narrowing the width of the intersection onto Wells Curtis Road from Westlake slightly to help define the intersection a little bit better, along with new striping, and to help create that definition between the different users. In those recommendations, we also want to take into account that there is a lot of traffic with trucks, with boat trailers, and also farm equipment that needs to navigate through this intersection. So we want to narrow it to make it feel a little bit more defined and comfortable for users, but we also want to make sure that we're not impeding any of those other uses that need to occur and still function. At the White Cliff Drive intersection with Middle Cheshire Road, this is an area that creates kind of a node with connections to the residential neighborhoods on either side of Middle Cheshire. Today there are crosswalks, but they actually don't connect to any sidewalk facilities right onto the road, and there are no ADA accessible curb ramps, things like that. So what we're looking to recommend is, having that highly visible crosswalk striping, making sure that the crossings are ADA accessible with detectable warning to let people know that they are approaching the roadway, and creating an opportunity for a node that would have some of those placemaking amenities like benches and wayfinding signage to direct people through the corridor and to some of the local and regional destinations. Routes 5 and 20 again is a fairly significant barrier on the corridor. There are no pedestrian amenities crossings there today on Middle Cheshire Road. So what we are proposing is the inclusion of an enhanced crosswalk with ADA ramps, with pedestrian signals that would be included as part of the as part of the traffic signal, and we'd be modifying the traffic signal to include those pedestrian signals with adequate crossing times for people to be able to traverse safely across 5 and 20. Some of the other improvements that we're including for the trail facility would be to show things like a change in pavement. What we're showing here is that an asphalt trail would then change into a concrete trail, which we're showing in this image some ornamental stone piers and bollards. These are all things that would help signalize to trail users that there's a change coming. I'm going to have to start paying attention, especially with something significant is coming up, like the 5 and 20 intersection. So the trail or side path would then continue further north up Middle Cheshire to Parish Street, the intersection of Parish and West Streets at Thompson Hospital. And again, we would be recommending improvements here, like the enhanced crosswalks, the ADA accessible curb ramps, and then creating things like nodes at that corner of the Thompson Hospital property on West and Parish Street. Now, some of those nodes that I had mentioned as I walked through, we'll be taking a look a little bit closer at that area around Thompson Hospital, but also the potential for an interpretive park trail at the water treatment facility, kind of in the middle of the corridor here that you can see highlighted in blue. Creating those connections from Middle Cheshire to the lake and to the downtown city of Canandaigua were things that we heard throughout the process as being important to consider and make sure that they're included in our recommendations. So looking at that Canandaigua water treatment plant facility, this here is just a very, very high level concept plan of an interpretive trail and park that could be incorporated on this property and create that connection from Middle Cheshire Road, which is on the left-hand side of your screen, to Route 16 and the lake, which is on the right. The concept for this trail would be to create a unique experience that would highlight ecological and natural assets on the property. As I said, this is a high level concept plan. So if this were to move forward, further study would have to be done to make sure that any environmental easements that occur or any environmental conditions that exist today, that what would be proposed for the trail would be able to function on the property with any potential regulations or constraints that may be existing out there today. These are just some representative images of the type of facility that we're thinking of with in this concept, creating elevated boardwalks or oval structures through areas that may interpret wetland habitat or other environmental conditions or unique situations that may occur on the site that could be interpreted for users of the park. In the area of Thompson Hospital, this was an area that through our site visit investigations, we noticed a lot, and we also heard through anecdotal comments through our public engagement process that a lot of people that work at the hospital or work at the doctor's offices or other facilities in the immediate area use this as a place to go and walk during their breaks or during lunch. So there was more of an opportunity here to include some unique placemaking elements, some more of those benches, bike racks, and also, as I mentioned earlier, possibly fitness stations or other sort of amenities that people can use while they're on their lunch break. This graphic here shows a little bit of that kind of placemaking elements in the background here. You see those benches, wayfinding signs, and what could be one of those fitness stations. But what this is also showing is the mid-block crossing on West Street that exists today that connects the hospital to some of the doctor's offices and a large residential apartment building complex on the other side of the road. What we're showing here is a raised table crosswalk. This crosswalk helps to bring attention to the crosswalk so vehicles, it will force them to pay attention a little bit more once approaching the sidewalk and help increase pedestrian safety. These are designed in a way that they do cause traffic to slow down, but they wouldn't impede any emergency vehicles, fire trucks, ambulances from being able to traverse over them. They are used in the area up in Rochester and in the surrounding Finger Lakes area. So they are able to function with snow plows as well, which is something that we hear a potential concern about when we propose things like these mid-block crossings. The switchback trail that exists today, I can't tell you how many times I drove by here. You know, this entrance to the switchback trail is near the intersection of 5 and 20. But how many times I drove by and never even knew that this existed. It's not easily accessible. It's not visible from 5 and 20. So as part of the study, it was important to take a look at this and see how we can create that better connectivity to the proposed ped bike facilities that we're looking at on Middle Cheshire Road, but how can we also make it more visible so people know it's there and make it also ADA accessible. So what we're showing in this concept is, and recommending, is that there is a kind of like a landing pad at the higher end of the entrance to the trail. This could include you know, kiosks for interpretive or wayfinding mapping, and again, some of those benches and bike racks and other elements you know, placemaking elements to create that unique sense of place and to draw attention to the trail. But this also helps to create, with the landscaping and the boulders, an accessible route down to the switchback trail, which then connects to Westlake Road, and eventually you can make your way down to the city of Canandaigua. All right, and I think I'm turning it over to Sam, who's going to continue with some of the implementation and funding aspects of the project.
Great, thanks, Ted. So one of the most important elements of this plan is ensuring that there's a strong framework to achieve the proposed recommendations that Ted had just gone over. So we do have specific recommendations for the town and the city to implement that will result in a connected, cohesive corridor for all users of Middle Cheshire and West Street. And just to keep in mind that the recommendations in this report are conceptual level, and that these recommendations will need to be advanced through engineering, design, permitting, and construction. As such, additional analyses may be necessary, such as traffic impact studies, to fully evaluate the treatments that are being recommended. And the report goes into more detail than what you see here on the screen. But just what you're seeing here on the screen are short-term priorities that the town and city can work together to implement to jumpstart implementation of these improvements along the corridor. So just a few short-term priority actions that we have listed here include completing final design and engineering of the recommended improvements, as well as the completion of a corridor-wide signage and wayfinding plan. And for every action that's listed, there are also additional funding, potential funding opportunities that the town can leverage to get these actions underway. So Ted, if you can just go to the next slide, please. And speaking of funding, the implementation of the actions will likely require a combination of local, state, and federal funding sources as seen here on the screen. So there are a number of these sources that can be utilized and leveraged, recognizing that they can change annually. So it'll be something that the town and the city need to monitor closely. But these are just a list of potential sources that could be used. And moving forward, it will also be beneficial for the town and city to identify potential match funding within annual operation budgets, as well as continue relationships with local and nonprofit organizations to secure this funding. And so where do we go from here? Well, in the moment, we will open up the floor for comments and questions regarding anything that we covered today. And if there are necessary changes that need to be made to the draft document, we will definitely incorporate those. The final document from there will be presented to the town board for their approval. And the town and city should be underway with implementing some of these recommendations that are in the report. And so that really concludes our presentation segment of the public workshop. So here I would like to just open up the floor for any questions and comments that you can either provide in the chat box or unmute yourself and ask away. And for those who might not feel comfortable either unmuting themselves or asking questions in the chat box, we do have the project webpage, middlecheshireplan.com. And you can go to that website at any time to leave your comments and questions there for our project team, and we'll be certain to get back to you there as well. Okay.
I have a.
Yep, go ahead.
Are you ready for questions? Okay, I have a couple of questions. First of all, I am impressed with the plan that you put together. The visuals are great. It seems doable. But I do have a couple of questions, and one I saw in chat is about the wide strip on Wells Curtis Road. That would actually be on the south side of the road. Is that correct?
I tried to unmute myself there. On Wells Curtis Road, it would be a 5-foot strip on both sides of the road.
Okay, that wasn't clear. I also I like the idea of the park benches at certain spots along the road. I wish you would look at more of them. The third thing I had was winter walking and sidewalk usage. If any accommodation can be made for that. And finally, the Middle Cheshire wetlands area is really a prime part of this and would be a wonderful addition to making this more of a pedestrian community rather than a speedway, a two-way speedway. And I would encourage the town to look at that as a priority, since they already own, the city and the town already own the land that that would happen on. At least if they could make an initial start with a very simple walking plan through the wetlands and down by the water treatment center. Those are the comments I had. Thank you so much. It was really an interesting report.
Great, thank you. I see a question in the chat box that just relates to, would any additional right-of-way or easements be required to implement the plan? Related to on-road treatments or off-shared path treatments, I believe that all of the recommendations are within the existing right-of-way, except for the interpretive park and trail, even though the land there is owned by the town of Canandaigua. There are easements controlled by the Finger Lakes organization. So those will need to have approval by the Finger Lakes Land Trust, but they're fully aware of the recommendations that we have made and are on board with those recommendations. So just coordination will have to continue with them in the future.
Hi, it's Adeline Rudolph. First, I wanted to say I've been on several committees and I'm actually on other committees where Bergman is doing a report. And I just wanted to say this is one of the best reports that I've seen from a consultant regarding the progress. So I'm really excited about some of your recommendations here. I did have one specific question though. I noticed you had recommended a wider pedestrian bike lane on the west side of Middle Cheshire Road from Wells Curtis to Foster Road, and then the transition at Foster Road to the east side where it currently exists. It's my opinion that we should try to avoid crosswalks as much as possible across Middle Cheshire Road. I would imagine you probably did that for agricultural reasons, but is there any possibility of keeping that path the entire length, or the wider shoulder the entire length on the east side of the road as opposed to switching the crossing there at Foster Road?
We can take a second look at that, but some of the things that that drove that decision to have it on the west side of the road were some of the, there were less conflicts on the west side of the road. There were also things like drainage ditches and utility poles and available spacing on the west side of the road that would make it more feasible to do on that side. I agree with you. That is something that we consider when making recommendations like these. We can, thinking about consistency and having to prevent too many jig jogs across zigzagging across corridors and things like that. But we felt with having this one, it might not be too much of an issue with having that one crossing, but we can definitely take a look at that and even document that as a potential option to include that on the east side of the road to make it consistent as it goes into final design, as engineering drawings and surveys and things like that are done for the actual design of the project. That consideration could still be in there.
It could also potentially be alleviated by something similar to what's happening currently at the 5 and 20 and the north side of Middle Cheshire Road, where we have a little bit just wider shoulders, so that, for example, if a bicycle was traveling on the west side, they wouldn't necessarily have to transition to the east side as well.
Dick McCaughey, I have a question. Do we have any proposed startup dates for the actual physical work? When will this commence?
Well, first and foremost will be to have the town board approve the plan once all the final changes and comments received today are incorporated. And then from there, it could take a couple, like a year or two, to maybe secure funding to advance some of the engineering and design for the recommendations. So nothing will be set in stone within the next year, I would say, but I'm sure the town would like to get a jump start on securing funding to advance the recommendations in this report.
That's helpful.
I have a question.
Sure.
Are there that many bikers that use Middle Cheshire Road? What about walkers? Will walkers be able to go on that path safely?
Yes. The off-road shared use path is just that, a shared use path that could be utilized both pedestrians and bicyclists. It wouldn't have separation between pedestrians and bicyclists, but could be used by all users.
We were
Right.
talking about 6 miles worth of road work there from Wells Curtis to 5 and 20 at least?
Yes.
And we live close to Wells Curtis Road and the Westlake Road. You're talking about narrowing that area. Right now, sometimes trucks come down, in order to make that turn, they have to go, they're going south. They have to go way over and to make the turn because it is very steep in that one location. So narrowing it, I don't know if you're going to cause more of a problem than just leaving it the way it is.
Yeah, through our initial analysis of that intersection, we did run some truck turn kind of analysis to see if it was feasible to narrow that intersection slightly. That is something that, as these recommendations move forward again into engineering and design, that is something that would be looked at in more detail. And more analysis done to make sure that we wouldn't be reducing the function of that intersection for trucks, for farm equipment, for collector trailers and things like that.
Sometimes things on paper and you coming down several times is a lot different than you living there for 36 years and making that turn all the time. To me, it's maybe too narrow. At times, I'm not saying every time you turn, it's going to, you need that amount of distance, but it is a narrow location.
No. Well, we appreciate that feedback, and we'll definitely keep that into consideration. With you living there and observing things, those are things that we like to hear, that we want to hear from you during meetings like this, so that it's
just one more thought. The park area that you're talking about that would connect with bridges and natural areas going down to Westlake Road, that would be contingent upon buying that property next to German Brothers. Is that correct?
No.
That land is currently owned by the town of Canandaigua.
And it does go all the way down to the Westlake Road?
Yes.
Is it right by German Brothers there?
Pardon, could you just say that one more time?
Is it right by German Brothers? The end location?
I know that it's right by the water treatment plant.
Okay, sorry. Okay.
Yep.
Thank you.
Yes.
May I ask, is there any connection between the two proposed properties you're buying on the lake? Or are they not related? I can't visualize.
There is no direct connection, but this plan definitely is recommending improvements to expand pedestrian and bicycle access to the lakefront. But the purchase of that property is not contingent on any of the recommendations in this plan.
I would just hope long-term that you'll make them connected in some way.
Yes, and many of these improvements have the ability to be evaluated for side street and neighboring connections from Middle Cheshire to Westlake Road.
May I ask a question? I'm a member of the fire department here at Cheshire, which takes care of this district. And I have two questions and a request, or two requests, I guess, and a question. My first request would be to consider the Wells Curtis and Westlake Road intersection. For us to get a fire engine around there, and certainly our ladder truck, is really tricky. We use up all of that space because it's such a dramatic change of elevation in such a short distance. So if you could keep that in mind, we'd appreciate it. I'm not speaking on behalf of the fire department, but just from a personal standpoint, we use it all, and we want to get to as flat area as possible because these trucks are very long and very heavy, and things hang off the back, as you know. So if you could keep that in mind. On a similar note, when you have any off-road trails, not the ones alongside the road, but when the walking trails and stuff, if you could consider, or at least keep in mind, access from, for the fire department and EMS. Not our trucks, obviously, but you know, ATVs or any type of vehicle like that. If you're going to make trails, if you could make them wide enough that we can get ATVs, UTVs, gators, things like that back there, that helps a lot. Because when you have bike riders and walkers, ultimately you're going to have someone who's going to twist an ankle or something worse. And it's really helpful for us to be able to get a small piece of equipment back rather than try to carry them back and forth. Thank you. And then my question is, has some thought been given to who's going to maintain the sidewalks in the wintertime on a day like today? I just snowplowed my driveway this morning, and the walkway along Middle Cheshire Road's course covered in snow. I'm in favor of this, by the way, don't mistake me. But would this be something the town would have to maintain when they plow the roads, or once a day or something like that?
So this, oh, go ahead, Kimberly.
Actually, it was Sarah. I was just gonna say that at this point, I don't think we have an answer for that, but you're not the first person to bring that up. So it's definitely something we've had conversations about.
People are actually out walking on Middle Cheshire Road right now. It's really dangerous, needless to say, so.
Right.
Yeah, and I think as these projects move forward into implementation, things like maintenance agreements and strategies of who would be responsible for what, and also looking at any town codes or anything that may dictate who's responsible for clearing sidewalks and things like that. Things like that would have to be looked at and evaluated and considered as projects move forward.
Okay, I thank everyone for their time. You've obviously spent a lot of time, and I appreciate it.
Thank you. Thank you for your feedback.
One more question. Is this going to be an additional increase in taxes? They're considering 2 pieces of property. And now you're going to do 6-7 miles worth of road work. It's a lot of money to have coming out of the town.
So this plan is conceptual, as Sam had pointed out earlier. So cost hasn't been calculated yet, but as she also pointed out, you know, it's hopeful that we would be successful in obtaining funding, outside funding for some of these projects. There are several programs that exist that are used for projects like this. So we would absolutely be looking into that, but we don't have cost information at this point. It's too early in the project for that.
Is this the kind of thing you put everything down you want and then kind of cross things off?
I mean, I wouldn't put it that way, but you know, this is in concept. You know, this is ideally what would we like to be able to do to improve this corridor? What can we do to make it the safest for everybody who uses it, whether you're riding a bike or pushing a kid in a stroller or walking. And you know, and so we do want to make it safe, but that's why we do plans like this, is to try and realize, well, what are the different ways we could make those improvements? And then, you know, once, if the plan is adopted and we get to the point where we're ready to really buckle down and look at the engineering, that's where the cost and the details would get worked out.
There's a lot of questions on the chat. Where will you address the answers to that?
Yeah, I noticed that. And Sam and Kimberly, I don't know how much time you guys have, but I imagine we won't be able to answer everything in detail. But for everybody on this call, you can see there is this, actually the page that's up right now, there is a project website. So I imagine we could load answers on that. The town also has a page on the town's website that's dedicated to this project. On the town website, it's under projects and then Middle Cheshire Road. So we can load answers to that too at a later time if we can't answer everything here.
Yep, and I was just going to say that, Sarah, we can plan again too, and just so everyone has documentation of some of the comments that came in, we can make sure that we get these posted on the website under the meeting summary component, and then respond to all of these individual questions as well.
Can I ask just a question that I have? First, I think this all looks wonderful and I appreciate all the work that's gone into it and the opportunity to comment. Do you know, does it include, or could we get put in sooner than later, coming out of town and trying to turn left on Middle Cheshire Road, there is the left-hand turn lane, but it's quite crazy there. That intersection is really troubling, and it seems like an increasing number of accidents as traffic increases. So I just ask that you look at that and maybe not have that as part of this bigger project, but just as a matter of public safety. And the same issue is it's the current crosswalk at Middle Cheshire and Chatham. There's a slight blind spot when you're headed into town. And I think people like to challenge that 45-mile-an-hour speed limit anyway. So as a frequent walker, you really have to be very, very careful. There's no flashing lights. And I've talked to the town before and I was told there would be no problem to install the flashing lights, but it's never happened. So if you could take a look at that, that would be wonderful.
Yes, we can do that. Okay. And as we mentioned, we will be responding to questions that were received in the chat. Are there any others that participants would like to bring to our attention?
I have a quick question. Can you hear me?
It's very quiet.
Claire? Oh, sorry. Got a mask on. I'm in a public place. I just had a quick question. Is there a place to find the master plan for the whole town? And I bring that up because I've always thought the water treatment plant would be a great place to develop. And they're talking about buying the property next to German Brothers, which is a true hazard for people to walk across the road. And I'm just wondering why we're not taking that money and developing some of these plans that you've just put forth today. Are they connected? Is there a way to find out what the whole plan is?
I'm not exactly sure which plan you're referring to. I know the town does have some additional initiatives on their webpage as well, and we have taken into consideration the plans that the town have put forth thus far. What you see and what we presented here today is just a conceptual level idea for enhancing connections from Middle Cheshire Road to Westlake Road. So there's no master plan that includes that specific recommendation as of right now.
But shouldn't there be a master plan? We're talking about spending multi-millions of dollars for lots of projects, and I just want to know how they're connected.
Yes.
Can I jump in for a second? This is Kathy Manicotts. I'm town supervisor. I think there's some confusion about where all this fits in. So yes, we do have a master plan. We're in the process of updating it. And there are, excuse me, I'm losing my voice. There's others on this Zoom call who might have more information as well. But just in general, so this particular project that Bergman worked on for us, they're consultants, and we asked them as part of a grant or with the city to come up with a plan, a long-term, a short-term ideas for how to improve Middle Cheshire. We all know that Middle Cheshire that corridor can be dangerous. So this is their best ideas at this point based upon all the things that are in play. But for any one of these things to happen, that's the next step in what they were talking about as far as funding, hearings, if we have to do anything. So this is not written in stone, but this is them telling us this is a good idea if you want to make Middle Cheshire more travelable, if you will. So yes, there is a master plan. It's in the process of being updated. And as far as the other two properties, those are not done deals either. We're looking at them in much the same way as we look at this, as we do anything. So as far as any taxes going up, that would depend on, first of all, for any one particular thing, a bicycle path. Do we have the easements we need? Do we have the funding we need? Are there grants? So we take this as a plan and something, and we bring it to the public to see what people want. So no one should think that we know one way or another whether taxes are going to go up on any of this. We don't want taxes ever to go up. We're certainly not going to spend any taxes unless we have input, and that's the point of this. So
sorry, Kathy.
That's it.
Thank you to the supervisor for that. And I can hop in and just piggyback off of some of this too. The town of Canandaigua's website has all of our previously adopted planning documents. Our comprehensive plan, which I think is what Mary Claire Hamlin was referring to, probably or possibly, which is also the one that the supervisor pointed out that we are currently in the process of updating. But the previous adopted plan, in addition to many other plans, are all available to view on the town's website. You can, from the main page, you can go down towards the bottom. There's drop-down menus that you can click, and it tells you how to get to all of our approved planning documents. And so the comprehensive plan is the one that's the overarching umbrella for the whole town, kind of like our guidebook, if you will. And a plan like this one, when it's adopted, becomes kind of a subset of that. We also have plans for parks and recreation and trails, which talk about, there is some overlap with those. So, so yeah, this definitely does fit in with our overall goals for the town. So I do know that it's now 1 o'clock. I'll let Kimberly from Bergman and Samantha finish up, but I know we probably didn't get a chance to answer everybody's question in detail, but like we said, we'll make sure that it is put up to be viewable as soon as we get everything sorted out. This presentation has also been recorded, and we will get that loaded up to the town's YouTube channel too, so that you can review it or share it with others who didn't get a chance to see it.
Great, thank you. We very much appreciate everyone's time and consideration during this presentation, and we look forward to responding to comments and hearing from you further.
Thank you everyone for joining us. And thank you for our presenters and all the residents and committee members who joined us today too. We really appreciate all the feedback and all the input. So yeah, we'll get this loaded to the YouTube channel, and you can look for the questions and answers within the next day or two. We'll have it posted to the project website, middlecheshireplan.com, and also on the town's website, townofcanandaigua.org, under projects and Middle Cheshire Road. So that's all the time we have, but thank you again, everybody.
Thank you.
Thank
Thank you.